This is a short overview of electrotherapy to better refine or put together the terms and the different waveforms and parameters. We're going to start by talking about frequency. This is an item that you set on the device. Frequency is really how many pulses per second, abbreviated as PPS. It's also known as hertz or rate. We have high frequency devices like Russian or Aussie current, and a single channel of interferential would be at 25,000 hertz. Some interferential currents might even be at 4,000 hertz. This is primarily used for pain management, i.e. interferential, but it also can be used for muscle training if you're using Russian stimulation. Medium frequency currents are usually 80 to 150 hertz, and these are primarily for pain. This is used with the conventional TENS setup. Medium frequency is also known to be 20 to 80 hertz, and that's really where the NMES units, neuromuscular electric stim, for muscle training happens. And then there's low frequency setups, and this is the acupuncture like TENS, which is primarily, again, a pain setup, although it has certain characteristics when used at this low frequency. And the thought is that that low frequency turns on the descending inhibition. It doesn't just use the gate control. And then a reminder that frequency and pulse duration are inversely proportional. We can also set the pulse duration, so how long the unit is on. Sometimes it's also stated as pulse width, which is really inaccurate. So we'll try to use the term pulse duration. The longer the pulse is on, the less comfortable it is for the patient. So it's always a balance between how long the pulse lasts and how much current you can drive into the tissue to get the desired effect. We have continuous current, which is really uninterrupted. It happens in a direct current mode, and this is the type of current we use for iontophoresis. And for those denervated muscles, we'll show that, but it's not something you're going to be held accountable for. We have long duration, that's 1 microsecond or longer, and it's considered DC interrupted or pulse stimulation. There are certain machines that have this, but we're not looking at that as a clinical application in this series of lectures or things you're going to need to do in lab. Muscle. To gain muscle, we want to have a 240 microsecond or longer pulse duration, and you can set this on a biphasic machine. High volt machines sometimes can be adjusted to this level. Sensory stimulation is usually done in the 20 to 150 microsecond range. Again, this is the biphasic and high volt machines that have this type of pulse duration. Some units don't allow you to change that. Noxious stimulation is done between 100 and 1,000 microseconds. And again, if the unit allows you to do that, you want to set it to the longest pulse duration possible. And the types of currents or terms you might see are biphasic, alternating current like the Russian and the Aussie current. Interferential current would not be used for doing a noxious stimulation. We can also then set the intensity. It is the patient who controls the intensity of this, although it is a device setting. You have milliamps, which is the typical amount of current that we're going to use for our clinical applications, and it's listed as milliamps if you're using constant current. If it's a voltage driven technique, you're going to see that written as volts. You also have microcurrent, which is less than 1 milliamp of current. That is used for wound healing, and it's really at a subsensory level, not something that we've talked about in our class. The intensity impacts the ability to achieve your treatment goal. So sensory, we are usually doing that for acute and subacute pain as well as edema situations. Motor stimulation we're going to use for subacute and chronic pain as well as edema. We are also using motor level for muscle training applications. Noxious stimulation is used for chronic pain. What about those electrodes? Size matters. Bigger electrodes cover more surface area, and they also reduce the current density. So that might help you to recruit more motor units if you're doing motor stimulation to have a larger electrode. It does need to be applied on muscle. Smaller units, or smaller electrodes, focus the current, so that might mean it is easier to get the nerve stimulated for motor or noxious stimulation. Playing with the electrode size can sometimes be a matter of finding something that is comfortable and works for your patient. Electrode placement, again, you want to send the current through the area of interest. Closer together, we don't have as great a penetration of the current. Further apart, you have deeper penetration, but making sure that the electrodes are put on conductive tissue is important. We have electrode setups that include 2 electrodes. It's 1 channel. Those are used for all applications except interferential modulated in the tissue. You can have 3 electrode setups or monopolar setups, these are sometimes called, and that's used with high volt pulsed stimulation for the polarity effect. That's where we have a large dispersive and then 2 treatment electrodes in the area that we're interested in working with. And then 4 electrodes is a must for interferential quadrupolar where the IFC signal is modulated in the tissue, but any application can have as many channels as needed to get the job done. What are our goals of electrotherapy? So sensory stimulation is pain control via the gate theory. It's mostly controlled by the intensity setting, so almost any device that you have can be delivering electric stimulation at a sensory level, even your direct current device. Now that might not be your first choice, but anything can do sensory stimulation. Motor stimulation means we want to twitch to a full tetanic contraction, a full muscle holding, and that used at that level, we want to get pain control via the gate theory. So that's in the dorsal horn, the interneuron turns off the C fiber signaling, as well as with descending inhibition. And that's where the brain and the paths and the tracks that come down will actually inhibit A delta and C fiber transmission. The key when we're using motor level stimulation is that we need to cycle the on and off times or use a pulsatile type current so that we don't get fatigue. For muscle training, we use a longer pulse duration. We have an on-off duty cycle that mimics our muscle training regimen. So 1:3 or 1:5 ratio is what you're going to see. Most often it's 1:5 if you're really doing muscle strengthening or power training. Noxious stimulation is again used with chronic pain treatment, and we get both descending inhibition as well as turning on of the endogenous opiates. And we have to modulate the signal with that so that we avoid sustained tetany in the muscle. So what about electric stim for pain control? When we look at frequency, there's several different options. So 1 to 10 pulses per second is considered acupuncture-like tens. Typically that's given then a longer pulse duration. We want to have motor level response, and it's delivered with a biphasic current. And again, pain control via the gate and descending inhibition. An 80 to 120 or 150 pulses per second is considered conventional tens. We want a medium pulse duration. We're doing a sensory only response, and most of the current types can accommodate this conventional 10 setup. Pain control is only via the gate response. In that 10 to 80 pulses per second is where we get the motor response. Pulse duration is shorter if you're doing it for pain, longer if you're doing it for muscle treatment, and Russian high volt and biphasic currents can all be used to obtain a motor response. Noxious stimulation is done with high frequency, so 80 to 120, long pulse durations. We already saw 100 to 1,000 microseconds. And this is where pain control is via that descending inhibition as well as the endogenous opiates. So what about a biphasic treatment, conventional TENS setup? So this is describing what you might do if you had a portable TENS unit or if you use the biphasic setting on a plug-in-the-wall unit. You're going to set it to medium frequency, so 80 to 150 hertz. It's also the beat frequency if you're doing interferential current. So they're both pain control. My pulse duration should be 100 to 150 microseconds. My intensity should be strong sensory stimulation, and I'll do a 20 to 30 minute treatment, and I can do multiple treatments of those during the day. I also want to modulate the signal so that I reduce adaptation or habituation to the signal. These are things you can set in the device via pre-program, or you might be selecting this as part of your treatment setup. You might be able to modulate pulse duration, pulse frequency, or intensity. and sometimes there's multiple combinations of those. All devices, again, can be used with this type of treatment setup. A common application for pain relief is to do interferential current. Remember, standard interferential current is a 2-channel or 4-electrode setup where the signals from the 2 channels intersect in the tissue, causing a resonant beat frequency that is in a medium range. So a typical device might be a 2500 hertz carrier signal, with the other channel being, say, 2600, and you can set that other channel high and low settings, meaning the amount that that signal varies. That difference between the two currents, again, is the beat frequency. So what's the benefit of doing standard interferential current is that I have that high frequency, meaning a low pulse duration, signal sent through the tissues, so that it increases the comfort, but then in the tissue I have that medium frequency pain descending inhibition signal. There are units that do pre-modulated IFC. The difference is I am doing that intersection in the device instead of in the tissue, and I only need 2 channels. When I do my electrodes, I want to send the current through the treatment area. So you may have a button or an option to set up sweep or vector, and really what you're trying to do is tune the current to the area of interest or issue. A typical treatment duration for IFC is 10 to 20 minutes. Electric stim done for muscle, let's talk a little bit about the frequency and the duty cycle. So my currents that I might choose would be biphasic, Russian or Aussie current, and high volt. For a muscle pumping action, I want to have 35 to 50 pulses per second. I'm going to use a 1-to-1 duty cycle, 1-to-1 on-off ratio, like 5 seconds on, 10 seconds off, and I'll do this for about 20 to 30 minutes. The rationale that I would use for a muscle pumping would be to reduce edema in the subacute. I might use a polarity effect, or for chronic edema management. I'm also going to do this to improve blood flow in a subacute or chronic myofascial pain or muscle spasm situation. I can use muscle stimulation for muscle reeducation. My pulse rate looks pretty similar. My duty cycle, I might start at a 1-to-1 or a 1-to-5 duty cycle, depending on how much fatigue. The more off time or rest time there is, the less fatigue. And I'll do this for a shorter amount of time. My purpose in doing this is to facilitate the muscle activation in an acute or subacute condition. This would be a patient post-op knee surgery whose quad isn't working. My duty cycle, again, needs to be set to avoid fatigue. You're trying to enhance the neuromuscular awareness of the muscle. You're not doing it for strengthening. If I'm going to strengthen a muscle, I need to use a pulse frequency of 30 to 80 pulses per second. The higher the pulse rate, the faster the fatigue. My duty cycle is going to be 1-to-5 or more. So I might use a 10-second on, 50-second off. I can even go 10-second on, 120 seconds off. And then I'm going to do enough contractions that it looks like muscle strengthening. So 3 sets of 10 reps is common. I want a strong tetanic response, and I should start at the lowest frequency to achieve that. So you may find a difference for some patients. At 30 pulses per second, the muscle is kind of fasciculating, a little wormy-like contraction. And if you turn it up to 40 or 50, then you get that nice, smooth, strong contraction. In patients who are really trying to do overload, you can put them so they're working against weights, which will enhance the intensity of the contraction. So if I'm going to use Russian current and I'm going to strengthen the quadriceps, the setup might go something like this. So Russian current is a frequency out of the device of 2500 hertz. I can have burst modulated to change that to a muscle training rate where those packets of 2500 hertz come out at 35 beats per second. Aussie current is the same thing. My pulse duration is not modifiable in this device. I have the same on-off time. So I can have a 1-to-5 or longer duty cycle. The electrodes that I want to choose, I can use 2 larger electrodes or 4 smaller electrodes For large people, I might need 4 large electrodes. Again, you want to have the current going through the area that you need. In this case, I'm going to set it proximal and distal on the muscle belly and try to cover both the medial and lateral quads muscles. My intensity should be a strong muscle contraction, and the treatment time is that needed to get 3 sets of 10 repetitions. So if I'm doing a 1 to 5 duty cycle with a 10-second on time, it's going to take me 1 minute for each contraction. So 1 set of 10 is going to be 10 minutes. 3 sets will be 30 minutes. So it takes quite a bit of time because you're allowing that recovery. I can do the same training using biphasic current. So this is not the Russian stimulation, this is the pulse duration that you typically see with a square wave, or it might be a square wave on top and triangular wave on the bottom. I'm going to set the frequency in the device to 35 pulses per second. I could go as high as 80, but again, my frequency will lead to higher frequencies will lead to more rapid fatigue. My pulse duration is between 250 and 300 microseconds. Same duty cycle, same electrode setups, same intensity, same amount of time. I have clinic devices that will do this, but there are also some portable units that can allow this to be a home program for patients. So as we think about electrotherapy, we need to consider the stage of healing, what your treatment goals are, and what type of treatment do you want. Do you want sensory? Do you want motor? Do you want muscle pump action motor? Do you want muscle strengthening? Do you want noxious stimulation? What are the indications and contraindications? Be sure that your patient really is ready for electrotherapy. You'll choose your mode or your waveform that you're going to have for delivery of that therapeutic dose. And then you have to then choose your parameters. So hopefully this brief review has given you a little more confidence in choosing parameters based on your therapeutic goal.